think that oftentimes when we think of diversity, we think of it from a numerical approach, that we need to have a quota and reach it in terms of, oh, we have this many people who are this. But when we think of it like that, we're not then thinking about why those people were excluded from those spaces. Hello. My name is Jeremiah Lee. I use they, them pronouns. I'm a clinical researcher and I'm focusing on queer health. I'm in regulatory science, which is basically the intersection between pharmacy and governmental regulations. So that's basically the FDA, where they evaluate whether medications are safe and effective. That's both in terms of manufacturing, quality assurance, but also evaluation of the medication in patients, post and pre-market approval. So my concentration is in clinical research. So before it's approved, and I'm working on trying to increase diversity in those spaces, especially for gender nonconforming people. I think the best way to describe how I grew up, at least in my childhood, was kind of like two-faced, I would say. I grew up in a very religious household. So my parents, took us to church every Sunday. And that was a very heteronormative space where I had to perform, being straight, being very by the Bible. The other environment I grew up in, I would say, is my school. I was around a lot of different people in terms of nationality, origins, religions. And when I was going through school, diversity was really celebrated, but I didn't really see that at the church, So there was kind of a conflict between being this, this good son for my parents, but also someone that saw people with creativity, with athleticism, and being able to do anything they wanted and feeling like I couldn't. And I wasn't allowed to do those other things being like drama or theater, art. But I think because of that, I felt very motivated to get out of that. That's also kind of why I came to California. I wanted to be in a place where I could be more liberal. I could be more open about myself and be surrounded with people that were inclusive as well. I had my first crush on a guy in 7th grade. And at the time, I didn't really know what it meant. I just knew that it was an instinct. It was naturally what I felt. But I struggled with it. I came out to a camp counselor at my church, and instead of being, welcomed with open arms, they didn't turn me away. They grabbed me and they held me, but they said, we love the sinner but hate the sin. And, that's always stuck with me because it's a really shitty thing to say, to like an 8th grader. And, after that, I slowly started to tell my friends, and they were, very welcoming, very open, always knew, It's always your friends that know. They always ask you, like, are you gay? And you always say no, of course not. But I was. And, that's how I started to understand at least my sexual identity. But in terms of gender identity, I don't think I really knew what it was that I felt. All throughout high school, I always wore my hair very long. I liked more feminine things. I liked makeup. And I would go into my mom's little collection and play around with it, even though I wasn't supposed to be. But those were ways that I was, I guess, tapping into an identity I didn't know what it was. And then it wasn't until at least college that I was realizing what it meant to be non-binary, what it looked like. And it's what I've come to for now. In terms of LGBTQ role models, I don't think I really had any that I thought of as an LGBTQ role model. I think I more so thought of them as really cool, i.e. being people like Eugene Lee Yang. He was a part of the Try Guys BuzzFeed series, but he was also very obviously queer. And, he was very flamboyant. He had his wild hair. And then he came out in his music video. And that music video really resonated with me because he was discussing finding his identity while also struggling in an Asian household. And I connected with that and I resonated with his message. So I think that's why I call him a role model. So in terms of community, at least for college, when I first started, I didn't really have a lot of friends. I started off, moving from another state, and I didn't know people. And I was also struggling with my gender identity. I didn't know how I could feel or manifest my identity because I didn't really know the language. I didn't know the terms. I didn't know the procedures. I didn't know what I could access to begin with. So eventually, once I found other queer friends, I started to go to the student union, the LGBTQ plus student center. And that's where I met a lot of people that had similar stories, backgrounds, and I saw, the struggles, the pains they went through, but also the achievements they had and the successes they had being in that space. And that's how I found a community at college. My STEAM role model was my current advisor, Dr. Church. So I did this Maymester, which is a semester abroad during May, and we went to the Balkans for a folk medicine class. It was a very interesting class, to say the least, and I never had him as a professor before, and it was during this trip that I got to know him better. And he was an openly gay man. He had a husband. He brought his husband on the trip, and I was just maybe not shocked, but I was very impressed with how this man could be so open and present and accepting, or really embodying his identity with no shame. And he was a role model to me. And that's the summer that I decided I wanted to do research. I wanted to get some credit, get a resume builder. And I communicated that to him, and he was like, totally, let's have you start with us. And I joined the USC Regulatory Science Research Team, and I was allowed to choose anything I wanted to do. So I was playing around with doing research on monkeypox or working on HIV. And I decided I wanted to do PrEP research. So PrEP, or pre-exposure prophylaxis, is a medication that can prevent the HIV infection. And I wanted to focus in on how PrEP was implemented or evaluated in the trans body. And I found that there was a lack of investigations in transgender populations, and I wanted to evaluate why that was, question and explore how we can remedy those past deficiencies. I found this really cool article, and it was talking about barriers to PrEP care, and it was talking about how transgender, especially women, felt that PrEP wasn't accessible to them, but also that it wasn't meant for them because they had known that there was a lack of clinical data of PrEP in their bodies. So I wanted to first evaluate to what extent that was true. What was the percentage of trials that were including transgender women? And what I found was it was barely exceeding 5%. There was a lack of representation for transgender, especially of women, but just in general, like non-binary transgender men were not included in these trials. The thing about PrEP is that it's only effective if it's taken daily. And there's also a lack of research on whether PrEP is safe and effective in transgender bodies, because oftentimes transgender people are taking hormones, they're going through different surgeries, but also there's a lot of social nuances to the trans experience. There's medical inaccess, there's medical discrimination, and all those things have to be factored in, but they're not. They're not being considered in these clinical trials. So that's where my research was spawning from. I wanted to look at what was the causes, what were the roadblocks from transgender people from entering a trial. And what I found was a lot of the times the language that they used in their eligibility criteria was exclusive or cisgenderist in terms of assuming that a patient was cisgender. Oftentimes they would only speak about sex assigned at birth and not really refer to gender identity. But for a trans or non-binary person, it's very important to have their gender identity affirmed, especially in a medical space. So that's where my research is focused in. Something interesting I found in my research is that the FDA does have guidances on how to promote diversity of sex, age, and ethnicity, but they leave out gender. And in fact, they also will often collapse the two together and say that sex is gender. And I think that's really damaging for a lot of people, especially queer folks that are dealing with trying to realize and manifest their gender identities. When I found that, I was shocked because the FDA is at the top of the rung. They are the people who are in charge of drug evaluation, and they're the people that are spouting these very outdated talking points. I felt like that was a real step back. How do hormones affect PrEP? The answer is kind of unknown, but still there are preliminary studies that suggest that there is a reduced efficacy of PrEP. But in order to solve that, you need to recruit more and test the medication in that demographic, in that specific population, in order to definitively say it is safe in that demographic. But a lot of the research I find and a lot of the literature says that trans women or trans men, they might not feel comfortable taking a medication that hasn't been tested in their certain demographic. In addition, a lot of prescribers can feel apprehensive to prescribe a medication that they might say, oh, like, I'm not sure if it will be safe for you. Another facet to that is that PrEP is not adequately prescribed enough. Research has found that a lot of prescribers will say that they are comfortable with prescribing the medication, but there is actually a far less percentage of them actually prescribing the medication. So there's both this lack of data that leads to misconceptions, mistrust in the medication, but there's also a lack of prescribing the medication in that target demographic. But there is a lot of promise in the field, at least. There's a lot of efforts by the California HIV/AIDS program. They're hosting a lot of different projects that are specifically looking at PrEP research in trans bodies. So it's not without hope, I would say. Clinical research is very difficult. Clinical trials are struggling to meet their quotas because it's difficult to recruit a lot of people that meet all their eligibility criteria. But I think one of the ways that you can increase at least gender diversity is to be clearly gender affirming. So you need to have medical providers that are receiving sensitivity training. They know how to ask, what are your pronouns? They know how to, not misgender someone. So all those things are really important so that you can increase trial diversity, but also have representation for people who are different. I feel like the struggle with what I do is I hate to say, oh, trans people experience HIV at a greater rate, because it sets up this myth or say this stereotype that trans women or trans people are carriers of HIV or more likely to spread it. But I think the way to understand it is that it's a systemic issue. As I've said, there's medical discrimination. There are doctors that may not understand or are willing to treat transgender patients. And so a lot of these compounding factors, social stigma, racial discrimination, intersectionality of people who are BIPOC, are also experiencing higher rates of HIV. So all those factors are at play. Basically, they found that HIV exceeded the prevalence rates in heterosexual couples than homosexual or gender minorities. But that's something they won't really bring up because there's this stigma or this stereotype that HIV is a gay disease. But it actually has been more prevalent in heterosexual couples. And I think that's something that is easily overlooked, maybe forgotten, something that we don't want to think about. And I often bring up PrEP to my friends or who might not be gay. They're like, why would I need that? I'm not going to be at risk for that. But in fact, PrEP is indicated for any sexually active adult. It is an STD. It can be passed from anyone to anyone. So it's not something that is inherently to the LGBTQ community. Why do I think that HIV is growing in certain heterosexual demographics? I think it's definitely the stigma that HIV is a gay disease. And next is that people think that it won't affect them. So with a lack of, I wouldn't say fear or per se knowledge of the disease, they're not going to then say, ask their provider oh, should I go on PrEP? Then you think from a provider standpoint is, oh, I have a straight woman. I don't need to prescribe PrEP to them. They're not going to be in danger of contracting HIV. These are some of the reasons why HIV might be growing in demographics of straight individuals. We're seeing the tension play out between social stereotypes about HIV and how that manifests in people's health outcomes with a lack of knowledge about HIV, and then also with a lack of clinical data of HIV in certain demographics. We're targeting PrEP in certain demographics that might not be the most at risk. And I think that's where we should be devoting research, is trying to use our resources properly and effectively and in the right demographics. So when I first started at my research team and continuing on, I'm the only one really interested in LGBTQ health. So being the only voice talking about these issues can be kind of lonely. But, having an advisor that is openly gay is very helpful. He's motivating me, he's guiding me, and he makes me feel that what I'm doing is worth it. Because a lot of the times it can feel like I have an imposter syndrome, that what I'm doing is just some liberal agenda and it's not important and it's just fake. So being the only person in my research team pursuing queer health research, I feel like I am the only voice that's bringing up these issues. But I'm reminded that that is a positive, because I am bringing up those queer topics, queer issues into those rooms that are predominantly cisgender, heteronormative. And when you start to bring up those topics and allow these people to interact with these ideas, it normalizes queer identity. By being more open about discussing queer issues, we can make it more normalized to talk about, rather than it being an exception, kind of a topic that is overlooked. So a lot of research in clinical trials will talk about diversity, and there's a lot of literature about how to increase diversity. And one thing that they mention is that you really need institutional backing. You need to have people in upper level management saying, this is something that we want to see. Because I can see that in a room full of straight people, they're not going to want to bring up queer issues. They're going to feel like they're the odd one out. So I feel that in my role as the only queer researcher, that I have to advocate for queer issues to move up the ladder, basically trying to make it more accepted by people who are in those seats of power, and bring those issues to light and empower queer people to be visible in research, but also just in terms of employment, so that they are hired or they're in those rooms to do that work. Some of the barriers for queer people in clinical research is not feeling welcomed and not receiving gender-affirming care. There's a long history of clinical research not being inclusive. We can think of the Tuskegee syphilis experiments, where patients weren't informed of their status and they were basically exploited. But aside from that, there's also a history of women not being included in clinical trials. I believe it was the 90s when the FDA required that women be included in data. Isn't that kind of crazy to imagine all those medications before then weren't evaluated in women? There are all sorts of historical examples where clinical research isn't inclusive due to the isms, racism, sexism, misogyny. All those things are at play in excluding minority groups. I would like to see genuine acceptance of queer people in the field of STEAM. I think that oftentimes when we think of diversity, we think of it from a numerical approach, that we need to have a quota and reach it in terms of, oh, we have this many people who are this. But when we think of it like that, we're not then thinking about why those people were excluded from those spaces. And then we're not also thinking about how we are treating those people. Because a lot of the times is that why we are excluded from those rooms or excluded from those jobs is that there is genuine transphobia, there is homophobia, there is discrimination. So when you just think of it in terms of, oh, we need to recruit these people, you're not then thinking, how are we then changing how we interact with those people to make sure that we are creating an inclusive space? My research focus is on trying to develop language that is inclusive for trans and gender diverse people in clinical trials. And that mainly what I'm doing is in the eligibility criteria of a trial. So that's the information like, oh, if you have this condition, you may not be fit for this. Or if you do have this condition, you're fit for it. A lot of the times there is sex eligibility criteria, but there is no gender eligibility criteria. So what I've been doing is advocating for clear and inclusive language that is welcoming to people who are gender nonconforming. And I think that really starts with governmental regulation that says that we need to collect gender identity, because right now what we have is simply sex, and that's not good enough. In August 2024, I'll be presenting at the National LGBTQ Health Conference hosted by Emory University in Atlanta, Georgia. So that'll be an amazing collaboration of queer health experts all coming together to share their research. And especially in a time where there is anti-trans legislation, but also just really a culture war over the validity of transgender identity. I think it's really important that we have these spaces of queer health experts banding together, showing solidarity with each other, but also advancing research for queer people. The title of my presentation will be Gender Diverse Inclusion, the Language of Sex and Gender in PrEP Clinical Trials. I think recently there's been a lot of tolerance of LGBTQ people, but not true acceptance. So I think that's the end goal for me, or the vision I have for the queer community, is to not only be tolerated, because I think a lot of people tolerate people saying, oh, you can do whatever you want to do, just don't bring it around me. And I think that's where we're at, and we need to progress to a state where you can be whoever you want, and I'm going to celebrate you. I'm going to be walking along you and protecting you from people who are against you. And that's what I think is true acceptance, and that's the vision I see for our community. For my career goals, I'd like to end up at the National Institutes of Health's Sexual and Gender Minority Research Office. They do a lot of work in what I do, clinical research for LGBTQ people. So I'd like to work in the government in terms of advocating for queer people in the realm of queer health. I feel like my personal goals are kind of like everyone else's. Like, I love to find a partner, settle down, build a little family. I'm allergic to cats and dogs, so maybe have a fish, something like that. That'd be fun. Some of my hobbies are reading, eating, and makeup. So I'm a drag queen myself. From a young age, I would watch a lot of these men doing makeup on YouTube. People like James Charles or Jeffree Star or Bretman Rock. And it really inspired me to pursue makeup for myself. And I think drag has been a way for me to kind of embody my femininity, maybe highlighting my femininity in ways. So one way that I did that was I was in my university's 14th annual drag show. So that was a really cool experience to showcase my makeup, but also my fashion. I think I'm what you call a look queen. So definitely someone that's kind of just in their bedroom and wants to paint their face really nice, and that's about it. I'm definitely not going to brunches doing backflips or death drops, which, do that. I won't. I don't think my body could handle that. But I think drag has been a really useful tool for me to express my queer side. To my younger self, I would definitely say YOLO. I feel like that's a cliche answer, but definitely do what you want to do. Don't feel so bogged down by family or social rules. Definitely go out and join the drama club. Do whatever you want to do. Do makeup. Tell your parents that you want to do artistic and creative things rather than feeling like you have to do what they expect of you. To those who are interested in this field, I would definitely say find a really good mentor, because there's a lot to academia that is gatekept, and they don't want you to know it, and they don't want you to succeed. They want to keep the information to themselves. But when you have a mentor that has been in the field, if it's a good one, they're going to want to share that with you. They want to see you succeed. Finding someone that's already in the field that may be aligning with your own identity, I think that's going to be a really powerful resource for you to go up in the field.